Hi everybody, good afternoon, Dr. John Hayes, and welcome once again. Today, no doubt you've seen some of the posts that we've put up about healthcare stories, in particular the story about the physician who was denied care or coverage for cancer treatment that provided life-saving benefits to him, denied by an insurance carrier. You know, there are multiple issues with the current healthcare system, none whatsoever, but I have two commentaries that I think are particularly important. Over 12 years ago, I wrote an article that's been republished many times called Fixing Healthcare with Common Sense, and I proposed a Medicare for All plan. However, the difference is in my plan and the plan that other people have suggested is that in my vision of Medicare for All, which I believe could be instituted in this country, everybody would have the opportunity to buy Medicare, meaning anybody, anywhere, who's a legal citizen of the United States could purchase Medicare as their primary health insurance. That means there would be an enormous pool of people paying into the system. Secondly, there are people in our society that should get their health care for free. Disabled people and veterans. No question, hands down, no question ever. However, if everybody, even people who were on public assistance, were required to pay some type of co-payment into Medicare, I believe that this alone would help to reduce fraud, abuse, unnecessary spending, etc. I'm not advocating a Medicare for All that's completely footed by government funding. That, in my opinion, is plain wrong. There are ways to do this, and I think it's high time somebody step up to the plate and make it happen. Also, watch what would happen to third-party insurance carriers. Could you imagine if everybody could buy Medicare, what the price of regular health insurance would do? I'm sure this is not going to be a popular discussion at all, but we do need to make some very significant changes. Also, we need to look at what's not working in other countries that have socialized medicine and all the difficulties that they're experiencing. So that's one issue. But the other issue is dealing with the current system we have. There are some things you have to be very, very knowledgeable about. Number one is you need to thoroughly question what's a covered service and what's a non-covered service. And you hopefully will know these things ahead of time before a crisis strikes. So important. Secondly, is if you do have Medicare or other health insurance, secondary benefits are oftentimes very, very helpful, and they're relatively inexpensive. Thirdly, all of us, as much as possible, have got to allot for some out-of-pocket expenses. Yes, even in a Medicare for All world, everybody is going to have to pay some portion of their care. I don't honestly see a way around it. However, all of these, ladies and gentlemen, are things that we are perfectly capable of fixing. Whether or not it happens, I don't know. I sure hope so. We're certainly working as physicians in that direction to make sure that everybody gets the care that they need and as they should. This given the fact that we have the most wonderful healthcare system in the world. But for the time being, as I said, common sense, ask questions ahead of time, do your homework as much as you possibly can, and also, please tell us, what do you think? What are your answers? What are your solutions? What would you like to see done? Let us know, and we'll do our best to get them out there as well. Meantime, thanks for your support. Thanks for all your kind comments this week, too, on the PBM, photobiomodulation, laser therapy, and some of the other alternative therapies that are really promising. You're going to see some really awesome stories this summer about the stuff we've been doing with that, too. All right, have a great rest of your day, and we'll talk soon.